Hello, I am Dr. B.D. Rao of Pushpa Clinic and founder of the websites qmedicaldoubts.blogspot.in and Dr. Raghava medicaldoubts.in. In these videos, I am providing basic knowledge about the commonly occurring diseases for the knowledge of the general people and for the basic knowledge for medicals. Today I am going to discuss about the atelectasis in children, diagnosis and treatment. Atelectasis or pulmonary collapse is a condition where a portion of a lung or whole of the lung fails to expand at birth, called congenital or collapse after expanding fully. Acquired atelectasis. It is classified into congenital atelectasis, and it is again of types primary atelectasis. There is initial failure of alveolar expansion common in premature and low birth weight infants in whom there is immaturity of the respiratory muscles and abnormalities of the alveolar ducts. Secondary atelectasis. There is collapse of the alveoli after initial expansion in the various pulmonary disorders of the neonates. It's called a microatelectasis. Acquired atelectasis. The atelectasis occurs from bronchial obstruction, either intrapulmonary, intraluminally bronchial obstruction by foreign body, secretion, adenoma, etc., resulting in non-secretion of the segment of the lung distal to the obstruction. This is called resorption collapse. Extraluminally by external pressure on the lung, like lymph node enlargement, tumors, and the enlarged heart, etc. This is also called a compression collapse caused by pleural effusion, pneumothorax, tension cysts, or space occupying masses. The other is post-operative atelectasis. Massive atelectasis resulting from the prolonged general anesthesia, especially following thoracic surgery. It may be aggravated by hypoventilation during post-operative period, post-diphtheritic paralysis, or poliomyelitis. Clinical features. The signs and symptoms depend upon the extent of atelectasis and the acuteness of the onset. Common symptoms are fever, tachypnea, dyspnea, cyanosis with signs of mediastinal shift to the affected side. There is elevation of dome of diaphragm of the involved hemithorax and compensatory emphysema of opposite lung when the collapse is insidious. The condition may cause no symptoms at all. Though the area is large, the percussion note is often impaired. The breath sounds are diminished or absent over the atelectatic area. Diagnosis. Radiology. Usually it alone can establish the diagnosis. Posterior, anterior and lateral films are not needed to look at the involved segment. The collapsed region appears to be homogeneous density in X-ray. The diaphragm is displaced upwards on the side of the lesion along with the shift of the mediastinum to the same side and compensatory emphysema of the alveoli. Bronchography. It is useful for diagnosis as well as therapy treatment. The treatment directed primarily towards the condition and symptoms. The postural drainage and physiotherapy is started without delay. In persistent cases, bronchoscopic aspiration is resorted. Complication, infection, fibrosis, and bronchiectasis. That's all about the atelectasis in children. In the next video, we'll discuss about some other diseases. Thank you.